What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today, my guest is an outstanding clinician, not just in the world of sleep, but in the world of dentistry, that I'm honored to speak with today. Dr. Aarthi Raghavan practices in a suburb of Chicago, is a general dentist, just like I am, yay us, but she has a huge focus and some very big news about what she is doing in the world of sleep. So, without further ado, Dr. Aarthi Raghavan, how are you?
Good morning. How are you? I'm doing fantastic this morning.
Oh
Lots
my
of good
gosh.
energy, good sleep.
Yes, yes. And thank you so much for joining us. So, I have been super excited to share your upcoming journey into what I'm calling super specialization, as it involves with the world of continuing education and sleep, especially. So, would you mind sharing your good news? I'm so stoked for you.
Absolutely. I should say I'm honored to be here with you, Meghna. You were one of my first mentors in segue into sleep, as you've been for many, many people.
Thank you.
And you opened my eyes to so many things when I started this journey way back in 2019. And then I went on to also complete my mastery programs and then go on to take the board exam because that's just me being me. I want to know more. I want to do more, get into the
Learning
rabbit
never
hole.
ends. Yeah.
Yep. And then recently I realized I love this topic so much, and I love this subject so much. And I've learned that there's not many people who want to explore this since this is still an up and coming field. And when I got into sleep, I also realized that there is the integrated stomatognathing system, and we have the TMJ problems, the headaches, the migraines, um, the facial pains, and I just was so riveted. And I finally took the plunge to actually go into orofacial pain and oral medicine with USC. Oftentimes, like when we do a super specialty, as you call it, or the residency program, we do not have the opportunity to foster an existing practice, or, sometimes we have to give it up entirely. There's not many people who can be a part of an existing practice as well as move into the super specialty or like more training. I was just lucky enough that USC somehow thought ahead of the curve, which is University of Southern California. Dr. Clark's been fantastic. And I found a program that was a hybrid program where I do have to be there for boot camps um, at least once a year so that I can also work with patients in their presence, in the presence of the faculty. Um, but a lot of the training can also go on in a very hybrid mode with discussions, classroom discussions, thanks to technology and what we have right now. So I am super stoked to actually go into a specialty that not many have taken up yet. But there is definitely a need for it. And patients don't immediately receive access to care that they should otherwise be getting. So thank you for asking about that.
Yes. Oh, I wanted to celebrate this because, as you mentioned, not too many do it. It is huge. The need is huge. So kudos to you for stepping up and being the leader that all of us need. Jumping back into sleep, what started your journey into sleep? What got you going? I wonder. Or was there anything specific?
I would say it's a twofold thing. I have someone who's close to me who I have heard snore for a very, very long time, very long time. And, as children, like young adults or teens, you wonder about it, but that's about it, And then I eventually became a dentist, got into private practice. I don't know if it was my population that I would wonder why it would be such a nightmare to prep a crown on number 2, which is the upper right farthest molar for people who are listening, or number 15 or number 18, again, the farthest molars on some people, while others would have a wide, comfortable mouth opening. Oftentimes, when you're starting out, you are, especially the kind of training that we go through in dental school, is like somehow it's always our fault. And I started thinking a little out of the box, and
Wait,
I'm
you
like,
mean it isn't?
is this really my fault? Is there anything I can do? Because the patients would be miserable after a crown prep appointment. So would I. Like my back would be twitching, and I was young enough back then, but I started wondering and I started looking at Mullen-Patty scores. I have always been someone who's interested in the medicine of dentistry. I felt that dentistry has always been just a specialty of medicine. And I never thought that dentistry was a separate stream, or something that were completely disconnected from the rest of the body. I know perceptions are a little different between different dentists.
Things are
So this is
changing
how it,
though. So
I'm sorry, say that again.
things are changing though.
Yes, gratefully so.
Yes.
So that's where it started. And I started looking at, it's also a little bit of a matter of pride, like someone who came from India. Oh, this person's an anesthesiologist, and he was the one who gave us the Mohammed score. And I was like, let me look a little bit more into this. What is the concept? And that's where my journey into airway started. Obviously, the universe has its way of connecting people, right? Then I met you purely through social media, and I was like, okay, someone here is talking sense to me.
Cannot shut up about it.
Yeah, I think once you're indoctrinated, like none of us can shut
Correct.
up about it. So, um, and then rest is history.
That's amazing. Yeah, most of us, I find, have some kind of personal stories or personal histories. And I've been very open and honest on this platform, which, oh gosh, it's been so many years that we've been doing this podcast. But, watching my dad snore all my life, losing my father-in-law, watching my husband snore. So, yes, there's always a personal journey. And you mentioned how we connected on social media. So let's jump into that. I've been itching to ask you, what are your thoughts on the role of social media as it pertains to how we can spread the word and help educate not just our patients, right? Everybody around us, but also for collaboration between physicians and just the medical community.
That's a fantastic question. I would say some of my biggest mental breakthroughs have come through connecting with physicians of comparable mindset over social media, to start with you. But in the world of dentistry, I feel like we're so isolated. Like oftentimes we're solo practitioners, or at most, we're practicing with one or two other dentists who we're not often seeing all the time or collaborating all the time. And there is a fierce independence and individuality, which is great, but it also does not give us the same collaborative mindset that I feel like medicine sometimes has an advantage with, especially in a hospital setup or something of that sort. So despite the fact that I met you, took your course, which also gave me an insight into the fact that there are other dentists who are wanting to do this, because there were several other people. You have a group, that you put together where we can talk about sleep, et cetera, et cetera. The isolation was still pretty profound, to be honest. It almost took me 2, 3 years, even after getting board approved as a diplomate, to come out of my shell and truly start connecting beyond dentistry. It's almost like an imposter syndrome, because not many dentists do this. They don't want to, they don't care, even though the ADA came up with a statement way back in 2017 that dentists should be screening for sleep disorders and airway disorders. Um, Patients would be like, why are you talking to me about this? So there's this sense of coming into yourself, and that's probably why I was pushed to take the diplomate exam, because I was like, I need to first validate to myself that I'm doing the right thing by my patients and that I know what I'm doing. Despite that, it took me a while to come out of my shell and be like, yes, this is the right thing. This is the right path. There is scientific evidence for decades that we have right now on sleep. And yet there's not enough knowledge about that. Even though there are so many people in the field, starting from oral myologists to dentists like you who've written books both for dentists as well as for public, I still feel like there's so much void and so much need to talk about this. However, once I did start engaging more in social media, I found that it doesn't have to be collaboration just amongst us sleep dentists. There are other physicians, there are neurologists who speak the same language. I follow a neurologist, if I can name her. Her name is Dr. Meredith Broderick. She's fantastic. She's someone who also talks about the orofacial aspect and speaks about orthodontics and how MARPI and SARPI were part of her own journey to, eliminate snoring. And I think that's where it was almost like liberation. I was like, okay, I'm not the only one talking this language. And then, like, you also start collaborating with OBGYNs who actually talk about this and its impact on fertility. Oral myologists, who talk about this. So I would say collaboration, more than collaboration, it's just also in some form validation, exchange of learning. There is so much potential, and together as a collective, the ability to reach more people to do the right thing. Some of my patients who sought me out because probably I was the only person talking about myofunctional therapy in my area. And where did they hear about myofunctional therapy? On TikTok. Sometimes even as doctors and dentists, we slam things like, WebMD and Google are not your doctors. Like, go to a real doctors. So patients themselves have these fears. Like, they have family members who tell them, don't believe everything you hear on TikTok, or don't believe everything you hear on Instagram. And then there are still patients who are so self-conscious that they recognize that there's some missing piece of the puzzle, and somehow they've used social media to trust themselves and take that step forward. And I think that's where the power of social media lies.
Yeah, no, I agree. I agree in the collaboration aspect. When I started on my journey, 15 years ago, still is, I still collaborate with that specific MD. There was a cardiologist who we worked together on a patient where started with periodontal disease and me asking questions about C-reactive protein levels, opening up the conversation with the MD. And he was the one who opened my eyes to, and he said, Meghna, if you have a patient that needs more than one drug to control their hypertension, they should automatically get a sleep study. And yes, we study all this, but sometimes hearing things from a peer who is doing this real time. And I've always said it takes a village, right, to treat these patients. It's not like, I can drill a hole and fill it up and it's fixed, right? Especially for children, when we are screening and treating children, we need a tribe, a village to be able to do that. And a lot of times, patients finding out about treatment, because what is the general consensus that has been about us, our profession, all these years? What are we supposed to do? We drill and fill, right? Maybe even pull a tooth if you're into surgery. I haven't done surgery in so many years, but I understand, like, why your patients find you because, and then they ask, right? But why are you asking me these questions? Because that's what dentistry has been so far. So it's up to us, those of us that are now stepping up and saying, we're more than just a dentist, right? We are doctors of this system. So I love the fact that, we are collaborating, you are collaborating with all these amazing healthcare providers and not just MDs, right? Like you said, myofunctional therapists, speech and language pathologists. There's so many providers that go into this. So I completely agree with that. Now, is yours mainly an adult practice? Do you screen children as well?
So since I come from a general practice as of right now, our population of patients is more heavily leaning towards the adults. So that's where majority of the focus has been. But I do want to expand this more to children. Like, we're not a kids heavy practice. And Naperville is very specialty oriented. Like you do have a ton of specialists of all kinds in Naperville. We're very blessed to actually have that. So children are typically seen by pediatric dentists in, the majority of Naperville. Despite that, like I've had the opportunity to screen some children and talk about this to parents and talk about them falling asleep and but I would like to expand a little bit more because I feel like that's where we create the most impact. If we're able to identify this in a child, we're giving them an opportunity to blossom into the best versions of themselves, and B, as an adult, we're giving them a much better opportunity to have a greater health span. So as of right now, yes, majority of my practice with sleep has been adult.
You do screen
So
kids, right? You
yes,
do have
I do.
conversations.
I do.
Exactly. And that's all that is needed, the awareness, because I know you are very active on social media. I love your account. And for those that are listening in, I will have Dr. Raghavan's social media handles, all of her bio, everything in our show notes. So make sure you do follow her. But there's a lot of valuable information that you put out. And sometimes that's all that's needed for someone to go, oh my gosh, that's my kid, or this is exactly what my best friend was telling me about her daughter, stuff like that. So I think that that is some outstanding value that you are providing for your patients. Let's talk about a little bit about technology. You're technology heavy, just like I am. We love our toys, don't we?
Yeah.
Let's jump into emerging technology, or what is coming up in the sleep and airway space that you're excited about right now, and how it will help provide access to better sleep health for our patients.
Actually, I think as physicians, clinicians, sometimes we get too stuck on our clinical toys. Um, but what I am truly excited about is the direct to patient or direct to consumer access to certain things. I feel like the sleep side of the industry, if I might call it, is like ballooning with new technology every day. There's PhDs who are, inventing companies where there's sleep sounds and how to get a better rest, how to convert your room into a cave. One of the things that I truly and personally love is my husband and I recently got the Aura Ring. Like that was our New Year's resolution. And I was amazed by the data tracking and how it actually can convey a relationship to your cardiovascular age and I feel like when patients see this in real time, it does take certain patients to feel motivated enough to take that step. And not all of this technology, I would say, is inexpensive, but it's certainly out there for us to access, and they are improving every day. And the data about like periods of wakefulness and of course, the Apple Watch or the Samsung Watch, they're incorporating these things into the watch as well. But kind of like a type 4 sleep study almost, right? Like you have the pulse ox that is constantly tracking how you're sleeping, and there's data after data. The only thing that concerns me a little bit is sometimes, an 80% or an 80 score is considered pass and great for most people, but is it really a score that says you're sleeping optimally?
Mm-hmm.
Some of us probably, when we went to school, we were all about A plus and above A, So my concern is that sometimes with technology, the significance probably gets mitigated a little bit as to when compared to either a sleep MD looking at an actual sleep study. So there's pros and cons is what I believe, but I do feel, I believe I recently came across another tool where you could shut out snoring the snoring noise. Yeah, fantastic. But what about the person who's snoring every
Who's
day?
actually
That a
snoring,
little
right?
bit every day, you know? So there's pros and cons. I still feel like technology is going to play a huge role. I feel like sleep is going to be more of a direct to consumer technology based industry because there is so much power in collaborating with technology to make sure that our patients have continuous monitoring and actual real data to assess rather than just because even if we dispense a sleep study, like doing it over a period of time, um, sometimes it's not realistic, you know.
And then sleep studies we can only do so frequently, right? So what I tell my patients is things like the ordering, which I have one, I'm a huge fan, or some of the apps and all of that are screening tools. They're monitoring tools. They're not diagnostic because you still need the knowledge that our medical community brings. You know, as dentists, we're not allowed to diagnose sleep apnea, but we can help our patients screen for it. It's like, hey, this is going to tell you that there's a problem. So, for example, my family, well, my husband sometimes uses it, but the girls and I use the Sleep Cycle app,
Mhm.
right? And it gives you so much data. And it's interesting because now my teenager will actually make an effort to go to bed, go to sleep a little bit earlier than she would otherwise, because otherwise, like, TikTok and YouTube and WhatsApp and everything is
I
constant.
mean, with mom as you, what do we expect from a
You know
teenager?
what? You know what? It gets taken for granted sometimes. Oh, mom's here, she's gonna fix it. Or
That's
mom
true.
just keeps talking. That's all she talks about is sleep. But when you get graded, right, like you said, I call it brown people syndrome because we're so obsessed with those, like making sure we have the A plus. Is she's like, Mom, what was your sleep score last night? And I was like, oh, I was a 92. She's like, oh man, I was only at 88. I think I'm gonna go to sleep earlier tomorrow or tonight.
Mhm.
So it does help, right? It helps with the screening or it helps us identify that there's a problem. There's definitely a role that it plays. So I'm grateful for that. I agree with you on that. What has been the biggest challenge you have faced when you are having these conversations, either with patients, but also with the MDs that you work with? What has been the hardest thing?
With MDs, I would be honest. They are pressed for time. They do not have the time to meet us or to have the opportunity to truly collaborate with us because of the pressures of the way insurance and like the corporate system of medicine works right now. So, but once we meet too, um, certain ideological differences as to how we use or don't use insurance, how we're more focused on individual patients. I feel there are a lot of barriers to break, to be honest. But once we have the collaboration, I think it's a fantastic collaboration with our medical community and our fellow colleagues. And also building trust, I think, is very important. Like for us to be able to show that, hey, we are as evidence-based as you are. We're not just people who drill and fill teeth. Like I sit and pour through sleep journals, like literally every day, every topic that I could find, or the topic finds me, however that goes, and we want to do what's best for our patients from an evidence-based perspective. Because traditionally, I believe there's also been this perception, whether with patients or with other medical providers, that oftentimes dentistry is all about profits. I have to say it here, we
Only people knew the truth, right?
exactly, but we are physicians at heart. Like we went to this, we dedicated our entire lives almost to this, only to be able to serve people. Um, so that's what is at the core of what we do. I truly believe that that's what is at the core of what we do. So to be able to break this perception, whether it's with MDs or with patients, because with patients, it's like, I see my PCP regularly. Why is it that nobody ever talks to me about this?
Yeah.
Um, I just feel like as dentists, we have the opportunity to see these patients more often because we're seeing them repeatedly, either for treatment or for perio maintenances or for routine exams. It's more than just once a year. And we look at this area, which is directly involved in the whole airway and sleep
That's where
aspect.
your airway begins. Yeah.
Exactly. So, and then of course, all the education and the background, and oftentimes, especially, sometimes with female patients, like they don't manifest the typical symptoms of what's considered the usual and customary with sleep apnea, right? I've had female patients where the only symptom is GERD. And like after reading through and pouring through journals and journals and more evidence-based medicine, it's off of a clinical hunch that I say, I think you absolutely need a sleep study. Or oftentimes it's only bruxism. My female patients are active, they're out and about.
They're not overweight.
Exactly. They don't even know that they're tired.
Correct. That's their normal.
That's their normal, exactly, all their life. So they don't know what the other side even looks like. So those have been the biggest barriers. And I would say that is part of the reason why I like to share more on social media, because oftentimes, again, we are limited in the amount of time that even we get to spend with patients.
Correct.
We could talk about this all day long, but do the patients have the time all day long, or do we have the time to see them all day long? So I feel like it's a continuous process of exchange of knowledge, because only then, even if we have to do something, right? Like we have to believe that we're doing the right thing. And that belief stems from the fact that we've gathered enough information to be able to relate to something. And it's not just, oh, you mentioned about it and we're done and dusted type of a thing. So we even came up with the concept of sharing more little bits of information to all our patient bases through emails, like email blasts and almost like
A newsletter
little
of sorts,
newsletter
right?
of
Yeah.
sort, right? I feel like it will take a lot more effort than just pressurizing ourselves to be able to convey all of the information just in that first meeting or just the first time that we speak to patients. And it's an ongoing effort. At the end of the day, as long as it is in the best interest of the patient, I say, why not? Why not? And it takes a whole village, like you said. It takes my entire team to be on the same page. Like they are passionate, they speak about it, I speak about it. We collaborate on social media. The more patients hear about it, the for me, like a sleep study is like the bare minimum. We spend a third of our lives doing this activity, like the body designed for us. Everybody should be getting a sleep study past 35, in my opinion, and then repeating it. It's like doing blood work, like we should know, is everything okay? Is there something we should be concerned about? The idea that somehow this is on an as needed basis itself is something that I feel like should be broken.
For sure. We shouldn't be attempting to fix a problem. Our goal should be to address it before it becomes a problem. I think, as providers, that's our goal. That's amazing. As we wrap up today's episode, what are your top 3 tips for patients when it comes to their sleep?
Sleep hygiene, my favorite topic. Get to bed at the same time, preferably every day.
Even
Avoid
on the
screen.
weekends, even when you're on vacation.
Yep. And the body loves it. I feel like ever since I started implementing sleep hygiene, it's like the body absolutely loves it. It loves the routine. Yes, we do have circadian shifts to a little bit as summer sets in, and we have more light and things like that. So just listen to your body, but try to be as regular as possible. Avoid stimulants. Like I'm a huge proponent of speaking about caffeine, and it's almost romanticized having a cup of Starbucks and somehow getting maximum productivity out of people. I don't drink any caffeine. Here I am up at 6 a.m., like having all this energy. Give your body a chance, give it a break from stimulants. If we're not able to, then question why, seek help. It's okay to have a cup of coffee in the morning. My parents, being South Indian, just cannot open their day without like drip coffee, Exactly. Exactly.
I just love coffee, but I agree to the point that it shouldn't be your crutch to get through the day. You shouldn't be drinking, I don't know, whatever it is that people drink at 4 p.m. That is a recipe for disaster.
Yep. And
Yeah.
alcohol too. Like again,
Oh, yeah. No
most
alcohol for me.
families have the habit of having a wine. I mean, back in the day, even the process of winemaking and the purpose why it was made was different. Today, commercial wines are not what they used to be like a
They're
century
not
ago.
as clean. Yeah. Yeah.
Exactly. So avoid stimulants at least 6 hours before bedtime. And I'm also a huge proponent of avoiding a huge meal or a large meal. I feel like a dinner, like a proper early dinner, because it does tax the system. Like your rest and digest system is like working its tail off, you know? Um,
There's a reason we were taught as children to eat breakfast like a king and then dinner like
a pauper.
a pauper. So there's a reason. It wasn't just old wives' tales, right? There's some science and logic to it.
Yep. Which
Yeah.
oftentimes I personally believe our ancestors were super smart. Like we just have a tendency to diss everything because we have more technology. I don't think that's true at all. Traditional values are still fantastic, like clean eating, exercising, walking a lot, you know? We've been blessed with getting all that, hopefully through generations and families, even though not everything was documented. So I think we should merge the best of both worlds
Absolutely.
and just hope for a great health span like through our lives.
Yeah, and like we deserve, right? I mean, we've all of this advances, like let's actually make use of it to live better, healthier, longer lives. Thank you so much for joining
Thank
us
you,
today.
Meghna.
Yeah.
It's been beautiful talking to you.
Oh my gosh, likewise, we need to do this more often, just on the phone with a cup of coffee earlier in the morning, though. And for those that have tuned in, we will make sure you look at the show notes. We will have Dr. Raghavan's bio, all of her social media handles, all of the great work that she is doing for her patients, and just all the information that she drops. So make sure you do share if you have somebody that's in the Naperville, if you are in the Naperville and surrounding areas, and you're looking for somebody that can help you with your sleep, with screening for it, or even just a great dentist, you now have somebody that can be your person to go to. As always, share this episode, send her the love, follow her on social media, and I will see everybody next time. Thank you so much, Aarti.
Thank you.